Hello, good afternoon. My name is Jody Bryant. I am the course leader for the MSc Physiotherapy programme at Birmingham City University. It's lovely that I've had the opportunity to talk to you just for a few minutes today. Um, Paul asked me to talk to you about some work that we've done in collaboration with Paul and his team, where the idea or the focus of the work is to try and give my students, who are all master's level pre-reg physiotherapy students, a insight into the patient experience of pulmonary rehab. So I'm a respiratory physio myself, so the students are taught about respiratory disease and they're taught about the treatment of respiratory disease, and one of the obvious kind of treatment options that we discuss is pulmonary rehab, and we talk about the evidence behind pulmonary rehab, and we talked about what is involved in pulmonary rehab, and we talk about what the benefits of pulmonary rehab are in terms of the physiological, so the improvements that it can have in terms of strength, muscle power, function, and also the psychological, so the benefits to patients of attending group classes and of attending exercise that may support with increasing FEV1 and perhaps reducing breathlessness. And they listen to me talk about this, and we read the evidence and we look at that. But actually, for me, it's really important that the students get a bit of an insight into what's it like for patients. Why is pulmonary rehab a good thing? Why do patients want to attend it? What's the challenges for patients? Because obviously, when my students then go out into the workplace, they can hopefully combat those challenges or know the benefits, and that might support, improve referral rates. So when we did our session about pulmonary rehab, and when we did a little pulmonary rehab class ourselves, and we did the teaching about pulmonary rehab, Paul and two patients joined us virtually at the time because of the COVID-19 pandemic via Teams, and my students were able to ask the patients about their experiences. So, what pulmonary rehab did they attend? What was the best bit? What were the challenges? What kind of things do they do in the pulmonary rehab class? How does it make them feel? Is it beneficial, etc.? So, from my perspective as the lecturer, this was fantastic because I've got another voice coming through telling my students about the benefits of what we know is a fantastically evidence-based treatment option. But also, my students fed back afterwards, and it's been a consistent stream of feedback throughout our modules that when they hear it from a patient, when they hear it from a service user who is involved in that program, it allows them to get better understanding, it allows them to get a more unique picture of what that treatment is, and it stays with them. It stays with them into their practice, and it encourages them to refer people into pulmonary rehab or actually to go and work in pulmonary rehab as a clinician. So for me, this is something that we're going to repeat next year and hopefully the year after, and actually it's something that we do with quite a lot of our conditions, but it's worked particularly brilliantly in the field of PR. So thank you very much.